Okay, this is the last video. It will be the shortest one. We're going to talk about the organization known as ISONG, the International Society of Genetics Nurses, and they exist to provide standards for practice, promote the integration of genetics education for nursing students at all levels. They support and publish research in genetics nursing, and they network all over the world with people from different disciplines who also deal with genetics. And they try to be a leader and influence matters of public policy internationally. Their goal is to really be a worldwide community of people working in genetics, promoting best practices. It's a great website, and for your discussion board post, you're going to go into that website and explore one of its resources and kind of report back. All right, we're going to talk a little bit about forensic nursing and forensic genetics, but first, about 45 seconds worth of fun.
I also watched this show called Cold Case Files. On Cold Case Files, they solve old murders, and it's really interesting because what I learned from it is that it was really easy to get away with murder before they knew about DNA. It was ridiculously easy. Like, what was even going on back then? What was a murder investigation like in 1935? One cop would just walk in and be like, "Detective, we found a pool of the killer's blood in that hallway." And he would just be like, gross. Mop it up. Now then, back to my hunch. Look for clues. I'll tell you what we'll do. We'll draw chalk around where the body is. That way we'll know where it was.
All right, well, that's, a little bit of entertainment, but we are going to talk about forensic nursing, not for a long time. There's not as much stuff. Historically, crimes were solved using detective work and eyewitnesses, just like John Mulaney was saying. Back to my hunch. Then in the 1950s, people started trying to get a little bit more scientific, like polygraph testing, which is, some people think, junk science. At least back then, it probably wasn't very refined. Hair analysis, which is very imprecise, and blood typing. So they were an attempt at what we can do now. They were very imprecise and resulted in a lot of false convictions or a lot of unsolved crime. In contemporary forensics, DNA is used to solve or confirm the majority of crimes. DNA is also stored. If you are convicted of a violent crime, your DNA is stored in a nationwide data bank so that they can solve other crimes. Forensics nurses, including SANE examiners, are responsible for the collection of perpetrator DNA from victims of violent crimes. And if you work in an emergency room, this may be a role that you are asked to assist with. Samples are usually collected from underneath victims' fingernails, around bite marks. Sometimes you'll get the killer's or the perpetrator's DNA from that, and in the vagina or rectum if the crime was a sexual assault. What you need to know about it at your level, it's not much. Collection needs to be precise. You need to label it correctly. Everything must be done. If you don't, you've interrupted the chain of evidence, and now this crime might never get solved and this victim might never get justice. So you need to follow the procedures. There are training courses for it. It's really outside the scope of this course. But know that patients who might be carrying DNA evidence on their bodies should not shower, cut their nails, that you should try to not let them go to the bathroom until you can collect that evidence. And as I said, felons convicted of violent crime in the U.S. have their DNA collection stored in a data bank. Sometimes corrections nurses are responsible for collecting that evidence, or it may be law enforcement personnel. But that's really all we're going to talk about with forensics nursing. It's really a specialty in itself. If it interests you, by all means pursue it. But that's really the end of our content for this week.